And today our guest is Mike Maunu. He's the president and CEO of Oxygen4Life. And our co-host today is Andrea Cataneo. Welcome, everyone.
Oh, hello, Mike. Hey, guess what? Just for fun, because I was impressed with your background, I threw together a tiny little intro on you. Tell me what you think of this. CEO of Oxygen4Life, Mike Maunu, innovative wellness leader, a CEO of Oxygen4Life. Mike drives advancements in oxygen therapy to enhance health, vitality, and well-being. Wait, there's more. Powerful, proven entrepreneur with 20 plus years of experience. He excels at building, scaling, and impactful health-focused businesses. And there's more. Health advocate. Mike is passionate about helping people optimize their health and achieve peak performance. Welcome to the show, Mike.
Thank you very much. Excited to be here. When Frank reached out to me the other day after I saw Rebecca Casaba from DealMaker, our broker dealer, on his show, I had to connect. Love her. I deal a lot with Matt. I don't deal with Rebecca, but love them both. Love the team. Matter of fact,
I might have introduced them to Frank. It's possible.
I'm the first testimonial on their page.
It's a great, they have a great product, a great program. What did you think of it?
I love it. I just wish I would have done it sooner and not gone through some of the other platforms first.
Sure.
But being in the digital space, I realized the power of controlling the customer journey. Once I understood exactly how theirs worked, I made the jump, paid the money. And the very first day we opened up our crowdfunding raise, I saved a $10,000 deal I would have never known about from one of my existing customers that had a problem paying their money, and I was able to log into their platform and see it. So I called them on the phone and walked them through it and got the 10 grand. So it paid for what I paid DealMaker. So I would have never seen that if I'd have been one of the online portals.
I love it. That's the future of capital formation. And that's just one good example. They really have a nice, like Frank said, it's a nice, clean product, and we're going to see more and more of it for sure. People want to be able to learn about a company and pick up their phone and invest.
Yeah, exactly. And they keep making it better. So I'll just make one little correction. It was a great intro. I've been doing this stuff for over 40 years, and I've worked with over 75 different businesses or actually 100 businesses in 75 different industries as a business coach, digital agency owner, since 1997 online before the dot-com bust.
Yep.
So I love business. I love marketing. I love scaling. I love connecting people and putting deals together.
Well, because of your health-focused way of life, I think what happened was AI looked at your image and thought, how could he possibly have 40 years of experience? So they made an adjustment. That's all.
Yeah. I better get a hold of that ChatGPT and get my.
So we've got lots of good questions, and we're probably not going to have enough time because we have so much we want to learn from you.
Sure.
But Frank, do you mind if I tackle the first one? It's really kind of global.
Go ahead, knock yourself out.
So what was it that inspired you to transition from a lifestyle business to fully focusing on Oxygen4Life's mission to transform healthcare?
I started in healthcare in 1992. I co-founded a 9-figure direct sales company in the nutritional space, and then kind of got out of it because of regulatory issues and 50 state attorney generals. And then, like I said, went into coaching and business management and digital agency. When I found out about crowdfunding in 2022, and we just had our medical food product come out and that we can now make medical claims, then I knew that I could raise money and raise capital easier than the old days in the 90s, which Frank and I talked about, of doing PPMs. I personally did a reverse merger on the Pinks in 1997. Yeah, exactly. And I realized, all that stuff you had to do to be legal in 50 states. And I found out about crowdfunding. I said, what? You can simply file a doc and I can raise money from unaccredited investors and I can do it this easy. And I spent
the Jobs Act in 2012, we have to thank for that. And exactly. It didn't until 2015 could we use it, but you couldn't do it back then. There was nothing really like it.
And even for the first I think it was 5 or 6 years of the Jobs Act, it still had no teeth. There still was nobody able to do it. And I have to say, as part of my team, my in-house counsel co-wrote the book, Crowdfunding for Dummies, with Woody Neese. He was the technical writer of that first book that came out when the Jobs Act first was released. So when I saw I could raise the money, I said, now I can go full-time, but I know I have to give up my coaching business. I have to shut down my digital agency. I have to do all those things that investors are going to ask me. How much time do you put into running you're a health company. And when you have to sign your name to it and file it with the SEC, I had to say, I'm done. I'm 150% all Oxygen for Life. And that's why I'm here today. I turned it from being a lifestyle because I want to help and transform millions of people's lives, because there's so many people out there that are getting sick. They're getting sicker at younger and younger ages. Yeah. And there's really a simple cause and a simple solution. And we just need to get the word out.
Mike, what role does advanced imaging play in creating effective treatment plans, and how does Oxygen4Life integrate with these solutions?
Well, with our products, we already knew with our first one, our over-the-counter patented PEOs that came out in 2010 for cancer, cardiovascular disease, and inflammation. Then when we got the patent on the one for the medical food that we can actually make the claims it treats 13 diseases, we'd already proven clinically on wound healing, migraines. We've been published on reversing cardiovascular plaque, all those different modalities. But I needed something that we could scan somebody, put them on our product, bring them back in 30, 60, 90, 120 days, and actually show improvement. Because that's what it's all about. Too many companies are out there touting this and glucosamine this and that and everything else because someone said it does this. But show me where it's actually done something in the body. Have you given it to 20 people and had diabetic foot ulcers heal up and go away? And that's the only thing you gave me.
I love this. I love that you were able to get this medical designation too. And a lot of people don't understand that within the FDA, it's not like a 510K clearance like a medical device. It's a medical food designation that permits you to do what you're doing. Do you mind just explaining that for the layperson? Because it's a big deal.
Yes. So our PEOs are a supplement like all other supplements, except for we have a 20-year track record and they're patented on what they actually do. Then my patent owner went back and started doing more research in the journals, and they found out that almost every major chronic inflammatory disease is caused by an impaired what's called delta-6 desaturase pathway. It's what converts the essential fatty acids that we take in from the food we eat into the eicosanoids and PGE1, which are the leading anti-inflammatories, and they also help with speeding up the flow of blood in the body. Those become impaired. So you can take any of the major diseases, cancer, heart disease, diabetes 1 and 2, COPD, all of those, along with the D6D classification on Google, and you'll see that there's an impairment in that pathway. So what that means is once that inflammation starts, the body can't start to heal itself. So that's where chronic inflammation starts to develop, and it can go 10, 15, 20.
Evil.
Exactly, because you don't feel it, you don't see it, unless it's a skin disorder or something like that, or breathing. And then all of a sudden you have the stroke, you have the heart attack, you go in, you got 6 months to live, you got the diabetes, all that stuff. So the medical food falls under what's called the Orphan Drug Act. It was a carve out done right below pharmaceutical drugs. We actually did go through phase 1 of IND with the FDA, and it came back that our lipids, which are all organic plant oils, fall under another product that was submitted as an oil. So we were able to get all of the half-lives, the PK/PD, which is all the scientists need, it's what the government needs, what the Army needs, on how the product actually works and assimilates in the body. The big difference is, unlike supplements, you can make supplements in your bathtub or your garage and go sell it, and it wouldn't violate any statutes, okay?
Scary.
Exactly. I remember back in the day when Twin Labs, I think it was, got busted because half their products didn't have half the ingredients they said they had in it. So who's checking on them? With medical foods, they have to be made to FDA food manufacturing standards. So they have to be done in an FDA-approved manufacturing facility. We actually use one of the largest drug manufacturers in the world where we manufacture our products. They go through strict, stringent, environmental things. Each batch is tested when they come off the plant floor. Nestle manufactures it for us. Believe it or not, Nestle, like your cocoa mix, they're one of the largest drug manufacturers in the world for pharmaceutical companies. They manufacture all of our medical food product. So every bottle that comes off has to work exactly the same way as the one that came off last year, because otherwise, when a doctor's recommending this, you don't need a prescription, it has to work. And it has to work 100% of the time, okay? So that's the difference. It's manufactured to drug specifications, or food specifications, I should say, in those type of warehouses and facilities. That's what makes it so different. And then we can't make the claim, but a medical doctor can make the claim. It helps with the impairment of a delta-6 desaturase pathway impairment. Okay, so it bypasses that pathway, because normally by that time, the pathway's not functioning correctly, and it jump starts the inflammation healing. And as soon as that happens, the body can heal. We proved that in some work we did at the University of Miami, hyperbaric oxygen wound treatments. One of our doctors that run one of the largest pain clinics in Canada got all his migraine sufferers off of opioids, said, hey, just try the PEO's product, our over-the-counter. And as little as 90 days, there was like 12 or 13 people that weren't responding to hyperbaric oxygen, and it makes sense. They all responded and all their wounds healed. So we're talking holes in your legs. They lead to neuropathy, and then they lead to an amputation. And in the VA, the survival rate once you have a lower limb amputation for 70%, 67% of the people who have it done is 3.5 years. You die. If you lose a limb, you're going to die in a very short period of time. And those are the numbers direct from the VA.
What significance does obtaining the DLA cage code, if I said that correctly, what does that hold for Oxygen4Life? And how does it facilitate collaborations with government entities like VA and the DoD?
Yeah, it's the DLA is Defense Logistics Agency, and the government's famous for changing their acronyms all the time. It's the first step, so we have to go through a DoD clearance. We have to submit who we are, what our, our social, all that kind of stuff, what office building we're in. They run background checks to make sure there's no one in the facility that's doing something similar, or there could be somebody in an office in the building you're in that may be on the watch list. Yep. And you have to put down that you're not part of that. So it's the first step in being able to do business with the U.S. government, the VA or the DoD.
That you're not terrorists or bad guys.
Yeah, we have to certify where our equipment comes from, where our products come from. We're not doing deals with any agency or country that's been banned by the U.S. government. So those are the first steps you go through that they say you're okay.
Got it.
So it opens those doors because you can't even talk to them without it. And then the next step is you go to get on what's called the Federal Supply Schedule, which is a 5-year contract at a guaranteed price you can sell to any part of the government. So we've got that going on at the same time. We're working with the Department of Defense and the U.S. Army in their drug developmental and acquisition portion for the U.S. Army, for the war fighters, for TBI and PTSD with our medical food product.
Frank, I don't want to be a mic hog because I have a few more questions. Your turn.
Is that Mike or Mike, M-I-K-E?
Microphone.
No.
Mike
Hey,
and a mic hog. That's funny.
You know what? Listen, what sets Oxygen4Life apart in combining innovative and treatment technologies like ThermalLens and Brianta?
Well, I don't know any other, being in the space, and you guys have been around the block. Most companies that are out there raising millions of dollars are either doing it for a medical device, trying to get a 510K clearance, or a new approval, which takes years and millions of dollars. I think the average was like $30 million for a new 510K for a class 2 device came out, or they're trying to get a pharmaceutical drug approved, and it takes years, trials, all the rest of that stuff. So all these companies are usually separately raising money for one part of that picture. My expertise is going out and acquiring what we need to put the whole package together. So the FDA clearance is we got that about 18 months ago or 2 years ago on the ThermalLens. So that's already FDA cleared, so we don't have to spend money on that. Brianta has been patented for a few years now. Obviously already a medical food. It's based on our 20-year track record, 25-year track record with the PEOs. So we have that, and it reverses the neuropathy, the diabetes, all that stuff. So we've already got that one that we can sell. We have what's called AI Lumi. So when I hired my chief medical officer, who's the world's leading expert on infrared imaging, I think he's published 300 articles on it, or 400.
Is that David Blackledge, or is that someone else?
No, okay. His name's Dr. Marcus Briosky.
Got
it. He's out of Sao Paulo, Brazil. He works with the neuromodulation group at Harvard as well. They're getting ready to do something with our machine and our Brianta. He's the chairman of the American Academy of Thermology. Published, like I said, 400 articles on infrared imaging, cited over 2,000 other times by other scientists and researchers with his work. And when he came on board with us in November, he has an AI database of over 1 million scanned images.
That's
so
huge.
Literally in seconds, we can drag the image that the machine takes, drag it into the database. It automatically will spit out a diagnosis, prognosis for what's going to happen next, treatment protocol, and citations for the doctors if he wants to research more. So we already have that. Other
This is so
companies are trying
exciting.
to
This is
build
the
it.
excitement of big data. I remember seeing a technology 15 years ago that was at the forefront of this. And it was for a dermatologist to be able to look at the picture of a mole. And they had
Yes.
hundreds, at that time, hundreds of thousands of images. And based on everything they had, the more data they had, the more they can quickly make the diagnosis. And I was marveled at that. And here we are 15 years later with something that is going to revolutionize the way and how quickly a diagnosis can be given. This is fantastic.
And he did that over the past 20 years. And the database grows every day because he's working with doctors around the world that are submitting more data. The more machines we get out there, the more data we get. You know, and it comes back to an interview I saw with Elon Musk, maybe last month. He's begging people to upload MRIs, ultrasounds, CAT scans into his Grok AI platform because he knows that's where the future is. Yeah. Where are you going to get the data? Everybody else is starting from ground zero. We've already got over 1 million images in the database right now.
Yep.
So we have a complete package. So that's the whole thing I've always said. Why go get an MRI? Why go get a scan? Why go get anything done or have a doctor guess at what's right if you don't have a solution or a diagnosis? We have all of that in one company.
It's incredible, and I'm so impressed. And, you know, I brought up a name of someone who's on your advisory board, and I didn't research enough what it looks like. This other person you're mentioning sounds like so impressive. How extensive is your advisory board? Because execution, you know, having a great business, having great technology and all of that is so important. But, you know, Frank and I know in the investment community, they're looking at, you know, the jockey as much as they're looking at the horse, and probably more so. They want to see, are these people that can execute? And I'm liking what I'm hearing. Can you tell us a little bit more about your team and why your team is going to be able to achieve all of these amazing objectives?
Sure. Besides Mark Savetti, I already mentioned, my in-house counsel co-wrote the book on crowdfunding for dummies, blah, blah, blah. He manages all of our in-house stuff. David Blackledge is of counsel at Davis Miles, a big law firm here in Phoenix. He's a professor at Grand Canyon University, teaches law and ethics. He spent 25 years in government acquisitions in Washington, D.C. And he works with over, 25 of the largest angel groups on the Western United States. He's reviewed over 1,000 plans, blah, blah, blah. But I think, and then we have Marcus Briosky, who's the world's leading expert. He signed a 3-year contract with us and is moving his whole family from Brazil. First quarter of this year, his son's been accepted to ASU to go to school. The two big ones that I just got last week. So I knew my weak link was I needed a CFO that really got what we're trying to do here on the bigger scale, because I want to go to NASDAQ in 3 years, and I know we can do it. And so I reached out to my buddy, his name's Keith McCaslin, and he goes, Mike, I'm doing nothing right now. I just retired. I'm playing golf 5 days a week. I'm bored. What do you got going on? So I said, I need a fractional CFO. He goes, I'd be willing to come out of retirement for you. So Keith worked for the last 25 or 30 years at Blackstone and Wasserstein Perella in New York, in acquisitions, mergers. Wow. He's taken several companies public. He's written 2 books on the process, on how to do mergers and acquisitions, all the key details, internal controls. So he's got a huge background in exactly what we want to do. And he says, I'll come out and I'll work for free for you. I believe in what you're doing. I've known you for over 10 years.
For free, like with no equity, just because he loves you?
He got a little bit of stock, very small, to start with. And he goes, when you start raising more money, we'll come back to the table because you can't afford me right now. I said, I know that. So then I started sending him some information. This is on New Year's. He sends, he goes, Mary Sue, she's bored too. She'd like to come out and see what you have going as well. Well, Mary Sue is his wife. She's a 6 Sigma black belt in healthcare and hospital management. She's got 35 years as a doctor of pharmacology.
Wow.
She ran the VA hospital on the pharmacology side in Denver for over 12 years. She ran the Eisenhower Medical Center in Rancho Mirage, California during COVID, along with other things. She looked at our tech, she looked at our Rivanta, she looked at the medical on the back end, what a scientist would know or a pharmacologist know. She goes, you have a flipping home run here. Keith, we're getting on board with this deal. So she came on board as well. So we're just now adding her to the team. She's already established protocol for putting one of the machines in the VA to get us going. So I've identified the weaknesses because I'm not an accountant. I can't do that. I got to do what I'm doing right now. Yeah. I understand the science as well as anybody, my patent holder. I understand the tech. but I needed those key people. My son, who's 25, runs our digital agency. He's been building all our websites, our marketing campaigns since he was 17 years old, also working for doctors. And I have part of the rest of my team is all contract labor. They've been working with me for over 15 years on our agency. They're in Spain, they're in the Philippines, they're back east. So I have the pieces to get everything done. Amazing. And I don't have to go somewhere else and rely on somebody else to do the work for me. I know how to do it all myself, and my team knows how to do it because we've worked together for so long.
Awesome.
Very, very.
Can you share any upcoming, here's a note, before that, have you encountered any issues promoting plant-based solutions within a market dominated by traditional pharmaceuticals? And how have you addressed that?
No. You know why? Because I think there's such a great awareness today. You know, I went through for several years here and what people did and what's come about because of it without talking, you know.
And the medical food designation helped that too. I mean, you've really addressed a lot of those concerns.
Exactly. And it's coming from a doctor.
Yeah.
So the doctor, it has to be recommended by an MD that can diagnose and prescribe. So if it's coming from your doctor says, listen, here's what you have, here's what you need to take. Guess what? There's no side effects. The side effects are you're going to sleep better, you're going to have more energy, your brain's going to function higher, you're going to be stronger. It helps.
Frank, can I get some samples?
Yeah, we'll get some sent out to you. I have to send you the over-the-counter product, but that's fine. That's all I've been taking for 25 years. My stepfather's 92, been taking it for 20 years. My mom's I'm not supposed to say that, but 80 something. Neither one of them have ever had cancer, cardiovascular disease. They've never had a stroke, no signs of dementia, and they eat normal. They don't eat the best, but they've been taking my product because it protects that cell membrane that's so important, and it keeps oxygenation in the cells where it can do its job.
Awesome. Hey, Mike, I want to thank you for coming on today. And Andrea, again, thank you for coming on and answering some good questions. We learned so much today about Oxygen4Life. And stay tuned. We're gonna have this on all the different channels and whatnot. And Mike, if somebody wants to get in touch with you, how can they get in touch with you?
Sure. Our corporate website's Oxygen4Life, inc.com, like incorporated. And you know, if you hit me up, Mike at that email address, hopefully they'll post it here down below the video. Stay tuned. We're doing a new crowdfunding raise. It'll be starting at the end of this month. So you can get on the bandwagon as well.
And that's going to be on the DealMaker platform, right?
Yes.
Okay, great. Awesome. All right.
And before we go, I absolutely will be in touch with you about your coming to be a guest on my pod show called The Heart of Influence. So nice. I'll tell you more about that. We've had 1,500 episodes so far, over 8,600 guests. You'd be phenomenal. And I personally curate a group. Sean Callaghy, international speaker. He's spoken on Tony Robbins' stage 19 times. He holds 2 top 100 jury verdicts out of 1.2 million attorneys. He's blind. He skis double black diamonds. He's the creator of the show, and he and Bella Vreed are the co-hosts.
I told you guys would hit it off.
Yeah.
Nice.
So
all right, guys. Thanks
this was
so much.
great. Wonderful getting to know you, Mike. Thank you for everything that you've shared.
Same with both of you. Great.
Take care. Thanks. Bye-bye.
Thank you.
Take care.